Hello everyone. Am I audible and visible? Let me know. Then we'll start our class. Am I audible and visible? Okay, fine. Hello everyone. Welcome to Unacademy Future Doctors. I myself Dr. Dipti Kariya. I'm MD PhD Physiology and I'll take your physiology lectures. I'm associate professor and I'm educating MBBS, MD, physiotherapy, nursing and dental students. Okay, and I have more than 17 years of teaching experience. Now, basically this channel as well as these videos, they are for first year students. So if you have anyone in your contact who is taking admission in the first year, first MBBS, dental, physiotherapy, nursing, homeopathy, etc. So please share all these videos with them. These videos will be very much helpful for all the students. Okay. Now let me explain in brief about our subscription. We have two kinds of subscriptions. Number one, that is plus subscription. Here you can choose the best from the best. You can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and with 12 months and above subscription, printed notes are also available. Second is our iconic subscription. Here, your access to the best from two of the best. And which are these two? One, that is Unacademy and Prep Ladder with Unacademy. All the features I have explained. And second, that is Unacademy and Prep Ladder with Prep Ladder. Here, the features are you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags, and more, rapid revision and snapshots, treasures, and 2021 Dream Notes. We also have added certain features in our special classes. We made the classes interactive. Classes are interactive as well as live. You can have a facility of raise a hand. You can talk to your educators in between the class and get your doubts solved. You can poll for the learners too. You can never miss a class as you always get notified for your classes. You can get lecture notes. You can download PDF notes as well as you can access your classes at any time and at anywhere. Also, we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions, which are based on latest exam pattern. And along with that, we have also included detailed explanation too. These are our NEET PG September 21 toppers. Also, we have started Focus FMGE 2022 comprehensive batch from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch, that is from 15 December, that is for 3 months. You can subscribe from your mobile. You can use my code DIPTI10 to get 10% discount. You can subscribe either for plus or iconic subscription. Okay. Now, let us start with today's lecture. Now, so first, let me start with learning objective. What will we learn in today's class? Okay, so in last class, we discussed about electrical properties, or you can say excitability of skeletal muscle. Okay, skeletal muscle is an excitable tissue. So once it's excited, then there is other is contraction. So today we'll discuss about, first of all, we will discuss about contractile and elastic components of skeletal muscle. One of the very important and very confusing topic. Okay, also we'll discuss about various muscle length, different lengths, optimum length, resting length. Okay, we will discuss. Okay, motor unit, also one of the important topic, and contractile response, different types of contractions, isotonic and isometric. So these are today's learning objective. Okay, now so let us start with first one. As I told you, contractile and elastic components of our muscle. So a skeletal muscle, you can see it consists of mainly three kinds of components. Okay, number one, that is contractile components. These components are basically your actin and myosin filaments. Okay. Second, series elastic component. You can see here, these are your actin and myosin filaments. These are contractile component. In series to this, you can see here, these are series elastic components which are in series with contractile components. I will discuss in detail. Okay, so here these are series elastic components. Third, parallel elastic component. The name itself suggests they are parallel to our contractile components. Okay, so three different types of components today we are going to discuss in this first learning objective, that is contractile components, series elastic components and parallel components. Am I clear? Now, starting with first one, contractile components. As I told you, these are our thick and thin filaments. Which are those thick one? They are myosin filaments and actin filaments. Okay, these are present in your myofibrils. We have discussed in a previous class. Okay, now this is considered to be viscous in nature. Why? Because it offers no resistance to the stretch. Whenever there is stretching, there is stretching of this component, there is sliding of this actin filaments over the myosin filaments, so they do not offer any resistance to the stretch. And another thing is, once they get stretched, immediately they are not able to return back to their original position. Okay, so they get shortened. You can see here when muscle contracts, you can see here, this is in the relaxed position, this is in the contracted position. So here it gets contracted, then they will not immediately coming back to its original position. Okay, so they get shortened. Next, that is this, they form 3/5 of the total muscle protein. 3/5, or you can say 60% of total muscle protein is made up of our contractile components. They are actin and myosin. Okay, then so this is all about first contractile components. Okay, second one, they are series elastic components. Okay, as the name suggests, you can see here, these are your contractile components. In series with these components, we have series elastic components. Okay, so these are located in series with the contractile component. So example of series elastic component, that is, they are our tendons, elastic tendons. They are in series. You can see here, they are in series with your contractile components. Okay, now, so what is the role of this series elastic component? Okay, in the resting state, this series elastic component, they provide resistance to passive stretch. Whenever we are moving the muscle passively, the resistance is provided by series elastic components. Okay, and it explains how muscle is able to contract even when the external length doesn't change. Or you can see they are also important for isometric contraction. Isometric means length will not change. I'll show you. You can see here in this diagram, this is your isometric contraction. You can see here, okay, there is contraction but the length will not change. So how can it be possible? Because contraction is there. Okay, so you can see here, contraction is there. So what happens? Because of contraction, this length of contractile component decreases. Okay, you can see here, and this is compensated by increased stretching of your series elastic component. Am I clear? So this shows how muscle contracts isometrically. Okay, so this is about the series elastic component. Okay, and another thing, after that muscle regains its length. That is what, that also they have an important role. Okay, third are your parallel elastic component. You can see here, again we come back to the diagram. Again you can see these are contractile components, actin and myosin. Okay, then In series with them, these are your series elastic component, muscles, tendons, okay, mainly tendons. And parallel elastic component, these are parallel to this, parallel to contractile components. These are your parallel elastic components, okay. Now, so these parallel elastic components are what? Which structure of muscle forms parallel elastic components? These are our connective tissue sheets. We have discussed endomysium, perimysium, connective tissue sheets. Okay, then along with this actin and myosin, we have sarcolemma. Sarcolemma is cell membrane of the skeletal muscle and other filaments. They all form parallel elastic components. Okay, so again, let us revise. Contractile components are your actin, myosin. Series elastic components are your tendons here in series, and parallel elastic components are parallel to this actin and myosin, and therefore they are your we have discussed connective tissue sheath and endomysium, perimysium, epimysium, sarcolemma and other filaments. Okay, now what is the role of this parallel elastic components? Okay, this parallel elastic component, it explains why the muscle regains its original length, because as I told you, once this contractile components they get shortened, they will not easily gain their length. But this parallel elastic component, they explain why muscles they gain their original length after contraction. Okay, as well as in isometric contraction, these components are folded. I'll show you. You can see here, these are parallel elastic components. In isotonic contraction, what happens in isotonic contraction? Length changes, tone remains same. So what happens here? Because of contraction, your contractile component length decreases. Along with that, series elastic component length is also decreased. And here, this isotonic contraction, these are which parallel elastic components, they get folded up and they offer some resistance here. Okay, so these are your parallel elastic component, and they form parallel elastic component plus series elastic component. Total, they form 40% of total muscle protein, 60% by contractile components. Okay, so this is about different components. We have discussed contractile components. Try to remember all this. This is very important, maybe asked short questions. Actin, myosin. Okay, am I clear to all? Series elastic component. Series means they are in series, so along here in this series with this. So these are your tendons, and parallel to this are connective tissue. Okay, am I clear? So now, so this is first topic we completed. Now second topic, that is different muscle length, concepts about muscle length. First is optimum length. What is optimum length? Maybe asked as a short questions. Optimum length, that refers to length of the muscle. You can see here at which active tension is maximum. You can see here, this is active tension developed in the muscle. When the length increases more than this, then also tension decreases, because you can see cross bridges formation is reduced. Here, why active tension is highest? Because maximum number of cross bridges are formed between actin and myosin head. Okay, so here tension developed is maximum. So optimum length means length of the muscle at which maximum active tension developed. Okay, or develops. Second is resting length. Okay, resting length means the muscle length in relaxed state, when the muscle is relaxed, or you can say under natural condition in the body. In some of the muscle, resting length is equal to optimum length because they are performing highest action. So this is same. Then equilibrium length. Here it is not shown. What is equilibrium length? It is the length when muscle is cut free from the bony attachment. Suppose this is your muscle. Because of bony attachments here, it is slightly stretched. But if we cut this, this is not physiologically possible. But when we cut this away from both bony attachments, then the length which is present in the muscle, that is your equilibrium length. Okay? And initial length means the length of the muscle before which it contracts. The length of the muscle before it starts its contraction, that is equilibrium length. Okay, so this is about different concepts about muscle length. Okay, now next is motor unit. What is motor unit? Also one of the other topic. Nobody is answering, huh? How? Okay. Am I clear to all? Okay, fine. Now, next is motor unit. What is motor unit? Motor unit, that is functional unit of the muscle. That is the unit of muscle contraction. Okay. Now, so you can see here, motor unit. What is motor unit? That is alpha motor neuron. Okay, which is coming out from ventral horn here, and all the muscle fibers supplied by this alpha motor neurons. This is our motor unit. Okay, this is alpha motor neuron and all the muscle fibers supplied by it, that is motor unit. Okay, okay. Now the cell body of alpha motor neuron is present in the ventral horn of the spinal cord. Okay. Now, this motor unit has various types. This motor unit or motor neuron, it supplies different types of muscle, and accordingly motor units are of two types, type 1 and type 2 motor units. I repeat, what is motor unit? Single alpha motor neuron and all the muscle fibers they supplied by this alpha motor neuron. Okay. Okay. So now this, depending on the type of muscle fiber it supplies, it is of two types. Type 1 means it supplies slow muscle fibers. Slow muscle fibers are also known as red because they have good blood supply and large number of myoglobin is available. Whereas fast muscle fibers, they have less blood supply, they are white in color. Okay, so these are type 1 and type 2. Okay, so you can see here, depending on the type of the muscle fibers, you can see here these are two types of muscle fibers. Red because these are slow muscle fibers. These muscles are for postural activity. They have to be contracted for a long period of time, so they require more blood flow, so they are red in color. Myoglobin is also more for the storage of oxygen, and these are white, less myoglobin, less blood flow. Okay, so these are the types of motor units. Okay, now we'll discuss about red and white muscles depending on their motor units. Okay, so red muscles, which are also known as slow muscles, as I told you, these are for postural activity. If suppose I am standing or sitting for a while, some postural muscles, they are always active. Okay, and that is, these are our red muscles. Okay, now this red or slow muscle fibers or slow muscles, sorry, these are the muscle fibers of type 1 motor units. Okay, whereas white are muscle fibers of type 2 motor unit. Okay, now very important thing here one neuron supplies 120 to 160 muscle fibers because they do not require skillful activity. When skillful activity is required, number of muscle fibers supplied by one nerve fiber is less. You can see here. Suppose you here. So this nerve fiber, it supplies, you can see here, here, it supplies large number of muscle fiber in which in red or slow fibers. Okay, now, so this is all. So, and second is this innervation ratio is less in case of fast fibers. Okay, that is 6 muscle fibers per axon. Okay, now next is this red fibers or slow fibers. They are for postural maintenance, whereas phasic fibers, or white fibers or fast fibers, they are for phasic contraction, means fine skillful activity like the muscles of our hand. They have to perform skillful activity. So one nerve fiber supplies less number of muscle fibers. Okay, in red muscles, more myoglobin, so it is red color. Okay, sarcoplasmic reticulum is less because they do not require fast contraction, and when fast contraction is required, calcium requirement increases. Here calcium requirement is less, so sarcoplasmic reticulum is less extensive, whereas in white muscle, sarcoplasmic reticulum is more extensive. Blood vessels are more in the red muscles, less in the white muscles. Mitochondria is more in the red muscles, less in the white muscles. Okay, latent period is long in the red muscles, whereas short in the white muscles. Okay, then comes contraction. Red muscles contraction is less powerful, whereas white muscle contraction is more powerful. Red muscle, as I told you, used for longer duration activity, postural activity, whereas white muscle for short-term activity, skillful activity. This muscle, white, they fatigue easily. If we write down, we fatigue easily rather than we are sitting. So postural muscles, they fatigue slowly, they are slow muscles. And white muscles, they fatigue rapidly. Okay. Their metabolism depends on cellular respiration, and that is for ATP production. Here, these muscles, they depend on the glycolysis for ATP production. Okay. Now, properties of motor units. Okay. First is number of muscle fibers in motor unit. As I told you, numbers are directly proportional to skillful activity. So if the muscle fiber, that is slow, number of muscle fibers supplied by one nerve fiber, that is around 120 to 165. If these muscle fibers are fast, then one motor unit supplies about 6 to 7 muscle fibers. Okay, so this number is directly proportionate to skillful activity. Okay, you can see here, this is one motor unit. You can see here, it supplies this many muscle fiber. This is second one, it supplies other. It is like wires. Okay, so this third motor unit supplies other remaining muscle fiber. So number of muscle fibers in one motor unit depends on skillful activity. If the activity is skillful, less number of muscle fibers are supplied. If the activity is less skillful, postural activity, then large number of muscle fibers are supplied by one nerve fiber. Okay. Second is recruitment. Important thing, recruitment of motor units. What is recruitment? You can see here, when only this one motor unit is recruited, what happens? This would be your response. If you can see, more number of motor units are recruited, this plus this too, so response would be increased. Then again, recruitment means addition. If all these three are recruited, you will be having more response. Okay, so the response depends on three things. Number one, number of motor units activated. Second, frequency of discharge. If it is immediately one by one, then it would be more frequency of discharge. And third, resting length of the muscle. Okay, so these are the three things which affect the recruitment. Then comes all or none law. What is all or none law? Motor unit also obeys this law. All or none law means there is either full response or no response. If your stimulus is threshold, then you will get full response. Okay. If the stimulus is less than threshold, there is no response. Okay. So you can see that full response and no response. These are two things. Okay. When some motor units are active and other are silent, and after that what happens, other are active and the remaining one are silent. So this helps in smooth contraction of the muscle. Okay. Next is size principle. Okay. We have discussed slow and fast twitch muscles are there. Okay. So you can see one motor neuron, it supplies either slow fibers or fast fiber. If they supply slow fiber, they are type 1. If they supply fast fibers, they are type 2 motor units. Okay, we have discussed. So they have either supply to type 1 or type 2. Okay, now so these motor units, they are supplying either slow or red fibers or fast or white fibers. Okay, based on this, motor units are also of two types, type 1, type 2. Okay, so here suppose if the diameter is large, okay, and the motor neuron, if diameter is large, as we all know, conduction is fast. Okay, and large diameter fast conducting motor neurons, they are always supplying to the fast motor units. So they are supplying your fast fibers. Okay, so this is your size principle. And if the diameter is small, diameter is less, means myelination is less myelination, slow conducting fibers are there, and they supply slow motor units. Okay, so this is the size principle. And as strength of contraction increases, we are increasing strength, more and more motor units are recruited. Okay, so during mild to moderate activity, we will be having less fatigue. Why? Because oxidative fibers, slow oxidative fibers are taking part, and with increased activity, more and more motor units are recruited, so glycolytic fibers are recruited. Okay, so if suppose we are doing regular isometric exercise, isometric means length remains same, no change in the length. So if we are doing isometric exercise, then what happens? Slow fibers, they are increased, and if we are doing isotonic exercise, then fast fibers percentage increases. Okay, now next is our contractile response. Now contractile response means whenever this is your electrical response, action potential. Okay, and this is contractile response. So electrical response means whenever any action potential or impulse comes here, there is change in the membrane potential. This is electrical response. Okay, and now this electrical response is followed by contractile response. Contractile response means there is a phase of contraction followed by relaxation. So this is your contractile response. Okay, now there are two kinds of contractions, isometric versus isotonic contraction. Isometric, you can see here, this is isometric, length remains same. Okay, but what changes? Tension changes. These two things are there, either length remains same or tension remains same. So here length remains same, then tension changes. So length remains same means there is no active movement, or you can say there is, you can see, suppose if you are trying to lift something which is fixed here, then length remains same, no movement. And for work done, we have, what is the formula for work done? We require, there is external work requires the distance to be moved. So here there is no movement, means no external work is done. Okay. Now here you can see this is the example of isometric contraction. When person tries to push the wall, you can see here both the ends are fixed here and here. So length of the muscle will not change. So this is known as isometric contraction. Okay. Now, so here what happens? In this case, isometric contraction, what happens? Here you can see, because contraction is there, so length of your contractile component decreases. You can see here from this one, it becomes this much. Sorry, length of the, because of contraction, length of contractile component decreases. But this is compensated by stretching of your series elastic component. These are series elastic components which are stretched. Okay. So this is isometric contraction. Examples, as I told you, that when we are trying to push a wall, that is one. Second thing, second example is when we are, second thing is we are trying to maintain posture. Just we are standing and stretching is there. So there is contraction, but there is no active movement. Okay, so this is isometric contraction. Next one is isotonic contraction. Here what happens? Tone remains same, length changes. You can see here whenever we are trying to lift something, you can see here when I am trying to lift something, there is change in the length, but the muscle tone remains same. So you can see same tension tone, but length changes. Okay, so you can see when length changes, definitely distance is moved, so external work is done. Okay, now here you can see this is isotonic contraction. Here in isotonic contraction, there is contraction of contractile components. Along with that, parallel elastic components are also shortened, and series elastic components, now they cannot stretch more. Here you can see stretching and it maintains the length, but here they cannot stretch. They are also in their own position. They are also getting shortened. So there is decrease in the length or change in the length. Okay. Now examples are, number one, that is when we are walking or running, movement that results in contraction of your this contractile and series elastic components, as well as when we are trying to lift some weight. This is also example of isotonic contraction. Okay, so this is all about your today's topic. Now some questions as we are discussing. Let me explain in brief. First question, write down about contractile components of skeletal muscle. As I told you, actin and myosin are the contractile component. They are viscous in nature and they offer no resistance to stretch. So they are not able to return to its original length immediately. Okay, and they form 60% of total muscle protein. Okay, next is series elastic components. They are in series with the contractile component and they are your tendons. Okay, and they in resting condition, this series elastic component, they provide resistance to the passive stretch. Okay, and during isometric contraction, when contractile components they contract, the series elastic components they stretch. Okay, and third question, parallel elastic component, they are parallel to contractile component. They are connective tissue sheaths, myofibril, sarcolemma, these all are parallel elastic components. Okay, they are also passively stretched. Okay, and in isotonic contraction, these components, they are folded up. Okay, and these two series elastic components and parallel elastic components, they form 40% of total muscle protein. Okay, next we have discussed about various lengths. What is the optimum length of muscle? It is the length of the muscle at which muscle develops maximum, important thing here, active tension. Okay, this is optimum length. What is resting length of muscle? That is the length where the muscle is in resting state. In the natural situation, this is your optimum length. Equilibrium length, when we have cutted these two ends from the bones and muscle is capped, then the length present, that is equilibrium length. What is the initial length? The length at which or before the muscle starts contraction, that is the initial length. Okay, next important question, what is motor unit? Motor unit is single alpha motor neuron with all the muscle fibers supplied by this motor neuron. Okay, different types of motor units, type 1 and type 2. Type 1, that is slow fiber supplying, and type 2 supplies fast fibers. Okay, next is difference between fast and slow, or red and white muscles. Okay, red muscle, they have type 1 motor unit, white has 2. Motor unit ratio to red fiber, that is high, 120 to 161. One motor neuron supplies 120 to 160 red muscle fibers, whereas one motor neuron supplies only 5 to 6 white muscle fibers. Okay, another difference, they are red color because they have myoglobin, they have blood supply, whereas white fibers, they have less myoglobin, less blood supply, but more sarcoplasmic reticulum, because for fast activity calcium ions are required. Okay, this muscle red, they fatigue slowly, white one, they fatigue fast. Okay, now what is the relationship between number of muscle fibers in the motor unit and precision of the movement? If number of muscle fibers are less, movement is more precise. Okay, one motor neuron supplies 6 fibers, then more precise. It is like same thing. Suppose if you have one teacher between 6 students, so your work will be more precise. Same thing here, if one teacher between your around 120 students, then the work will be less precise. So this way, this is the ratio. Okay, then what is the relationship between force of contraction and recruitment of motor units? More and more motor units are recruited, more will be the force of contraction. Suppose one motor unit is recruited, force is 5. 2 are recruited, it becomes 10. 3 becomes 20. Okay, so this is the relationship. Motor unit, does they obey all or none law? Yes. If the stimulus is threshold, then response is there. Then stimulus is less than threshold, there is no response. Okay. What is contractile response? Whenever there is excitability, whenever there is stimulation, action potential given to the muscle, it produces contraction. This is your contractile response. Contraction are of two types, isotonic and isometric. We have discussed what is isotonic. Tone remains same, length changes. Okay. Here in isotonic contraction, tension remains same. What is the example? That is when we are lifting some weight, or when we are walking, or when we are running. This is isotonic contraction. Here what happens? Contractile components are contracted and series elastic components are also contracted. Whereas isometric contraction, here length remains same, tone changes, tension changes. Okay. So now here what happens in isometric contraction? What happens in isometric contraction? Here we have contraction of contractile components. Okay, And series elastic components, they are not contracted. They are stretched to maintain the length. That is isometric contraction. Next thing is, what is the example of isometric contraction? Here the example is whenever we are pushing a wall, there is no change in the length. So no work is, external work is not done. Other example is when we are standing, postural muscles, they are working, they are contracting, but there is no change in the length. So this is also an example of isometric contraction. Okay. So this is all about today's class. If you like my lecture, if you like my video, you can like it, you can share with all your friends, and you can subscribe our channel, that is Unacademy Future.